Hello everyone, welcome back to my channel Shivani's Maternity Mentor. Are you confused about the which diagnostic test is used for which obstetric and gynecological condition? So don't worry, it's today's video I will explain the most important differential diagnostic test in simple exam oriented manner. This topic is very important for GNM, BSc Nursing, PBBSc and MSc Nursing students as well as for Viva and competitive exams. So let's get started. What is differential diagnostic test? A differential diagnostic test is a test used to distinguish between two or more conditions that have similar signs and symptoms, helping to make correct diagnosis. Important differential diagnostic tests under that first one is urine pregnancy test. Detect the HCG hormone used for early confirmation of the pregnancy. Second one is serum beta HCG. Confirm the very early pregnancy. Help to diagnose ectopic pregnancy, miscarriage and gestational trophoblastic disease. Third one is ultrasonography. इसे short में USGP बोला जाता है. It confirms the pregnancy, assesses the fetal growth, gestational age, placental location and fetal anomalies. Next one is transvaginal ultrasound, जिसे short में TVS बोला जाता है. It is best for early pregnancy, diagnosis ectopic pregnancy, ovarian cysts and fibroids. Fifth one is Doppler ultrasound. Evaluates the fetal blood flow and placental circulation. Next is non-stress test, जिसे NSTP बोला जाता है. Monitor fetal heart rate and assesses the fetal well-being in high-risk pregnancies. Next is biophysical profile. Combines the NST and ultrasound that known as biophysical profile. Evaluate the fetal breathing, movement, tone and amniotic fluid. नेक्स्ट वन इज कार्डियोटोकोग्राफी, जिसे शॉर्ट में सीटीजी भी बोला जाता है. इट रिकॉर्ड द फीटल हार्ट रेट एंड यूरिन कॉन्ट्रैक्शन ड्यूरिंग द लेबर. नेक्स्ट इज amniocentesis, कलेक्ट द amniotic fluid used for prenatal genetic and chromosomal diagnostic test. नेक्स्ट वन इज कोरियोनिक वेलस सैंपलिंग, जिसे शॉर्ट में CVS भी बोला जाता है. अर्ली प्रीनेटल जेनेटिक टेस्टिंग परफॉर्म ड्यूरिंग द फर्स्ट ट्राइमेस्टर. Next one is complete blood count. Detect the anemia, infection and platelet abnormalities. Next one is blood group and RH typing. Identifies the RH incompatibility between mother and fetus. Next one is oral glucose tolerance test. Diagnosis gestational diabetes mellitus. Next is urine routine and culture. Detect the urinary tract infection and proteinuria. Next is torch profile. Screen for the congenital infection and affecting pregnancies. Next one is thyroid function test. Detect the thyroid disorder during the pregnancy. Next is pap smear. Screen for the cervical cancer and paracarcinous changes. Next is HPV DNA test to detect the high risk HPV infection. Next test is colposcopy. Examine the cervix after the abnormal pap smear. Next one, hysterosalpingiography. Evaluate the uterine cavity and fallopian tube patency in infertility. Next is hysteroscopy. Directly visualize the uterine cavity. Next is laparoscopy to diagnose endometriosis, infertility, ectopic pregnancy and pelvic disorder. Next is CA-125 test, tumor marker that support the diagnosis over ovarian cancer. Marker that support the diagnosis of ovarian cancer. Remember these high yield topics. प्रेगनेंसी कंफर्मेशन के लिए यूरिन प्रेगनेंसी टेस्ट एंड बीटा HCG. For ectopic pregnancy, beta HCG plus TVS test. For fetal well-being, NST, biophysic profile and CTG test. And for diagnosis of gestational diabetes, glucose tolerance test. For cervical cancer, best diagnostic test is pap smear plus HPV DNA test. For infertility, HCG plus laparoscopy. And for genetic disorder, CVS plus amniocentesis. Understanding the purpose of each diagnostic test is essential for the clinical practice, viva examination, and nursing entrance exam. If you found this video is helpful, don't forget to like, share and subscribe to Shivani's Maternity Mentor for more easy exam-oriented OBG nursing lectures, notes, posters and MCQs. Thank you so much for watching. See you soon in next video.